When we refer to palpating a pulse or pulse palpation, what we're referring to is feeling the artery's pressure pressing back against our hand and the mechanical forces we're applying with our hand to that artery. And there's several different places on the body we commonly check for pulses, one of them being the carotid artery, found on either side of the neck. Moving downwards, we'll find the brachial artery on the inner aspect of the elbow, or the antecubital region. Usually we'll utilize the brachial artery for measuring blood pressure. We also have the radial artery on the outer aspect of our wrist, closest to our thumb. This is one of the most common sites for palpating pulses. And moving downwards, we also have the femoral arteries, which we can palpate in the inguinal or groin area. Further down the legs, behind the knee, we'll find the popliteal pulses. And then on the medial aspect of the malleolus or ankle, on the lower legs, we'll find our tibial pulses. And lastly, for these purposes, the top of the foot is where you'll find your pedal pulse or your dorsal pedal pulse. Now, anywhere you can feel an artery pulsating against your hand's pressure, you can palpate a pulse, and some of the less common areas to palpate would be the temporal artery on either side of the front of the head, the axillary region or armpits, and then the ulnar aspect of the wrist as well, or the inner aspect of the wrist closest to the fourth digit or pinky.